Afternoon. My name is Dorcus Kabahinda. I am a child psychologist and therapist. But with the trends that are happening right now, it is inevitable that we find ourselves in the adult section and the section of supporting mental wise to the communities and the people, because there is an intended disruption in mental systems that the skilled have quite very few. So we find ourselves in that sector. But I'm a child therapist, child and adolescent. That's what I specialize in. And today I bring to you a topic: mental health supportive role in the age of digitalization. Yes, this is the topic that comes up: mental health supportive role in the age of digitalization. Yeah. And in regards to this topic, what comes to your mind? What are the thoughts that come to your mind, even as you do the different activities or as you walk around the countries? Welcome to this session. If it was interactive, we would work around it. But now that it's not, I would want to share with you what is digitalization in the retrospect of mental health supportive role. Is digitalization visible? Is it reliable to a degree that it can replace the systems that are face to face, or for example that are direct interaction? Is it a contribution that has made a big impact that can support those that need the mental health care? Mental health supportive role comes in different aspects for different organizations and capacities. But when we look at the norm, the rights and the norms and the directions to which we take, the mental health supportive role comes with assessments, providing day-to-day care and psychosocial needs. It comes with developing of treatment plans in collaboration with other health professionals, and sometimes administering medication, monitoring patients and physical and mental health, and keeping accurate records. All mental health specialists, different counselors, psychologists, psychiatrists, their major aim is to support and restore patients, clients, participants, depends on how you would call it, depends on how you would look at it. It depends which aspect are you looking at. Most organizations would call it a client or a participant, or some areas like hospital clinical settings, they would call it a patient. The mental health supportive role is one that is indented for every therapist, that we ought to see that our main objective is do no harm. Do no harm. How do we support this client? How do we see them getting restored? How do we see them improve? And it has come in contact with what we would call digitalization, technology, the services, the processes that we have to do, most especially when it came to the time of COVID. It was indebted to us to still support clients, participants, our survivors of trauma, that mental health role and supportive role had to continue. But is digitalization and technology doing what it's supposed to do? Or is it an advantage to the processes that we do? Let's have a look at it. Digital mental health uses digital technology to deliver mental health services. During the treatment process, the mental health issues professionals use digital interventions. You can use online therapy, avatar, avatar systems. You can use virtual reality therapy, mobile apps. We've seen quite lots of them. Stress management, CBT, and many of them. They are on Play Store and other platforms. We have other digital platforms, school platforms, organizational platforms that support clients and survivors and trauma affected persons with with the supportive role of mental health. Digitalization is a novel phenomenon that has been elevated with the use of information across various domains. In mental health, when you relate it to technology, is there a prime interest? Is there research that has happened that shows that it is visible, that it's able to support our victims, is support to help those that have come up with disorders? Is it able? Yes, it is able. It comes with so many advantages, but also it comes with so many disadvantages. Digitalization of mental health care, onset benefits. We have accessibility. Clients and participants can get access, like accessible to the different support that they need. Like during, like the example I gave during COVID-19, uh, clients were able to access these services, the support. One of the examples that I can give is I remember during lockdown where one of my clients called on phone and we had to go on telecounseling, and she called, she had high anxiety levels, she had some panic attacks, but she was supported through telecounseling, and we did um step by step telecounseling. It was not visionary, you couldn't see her because it was just on phone, our normal small phones. But was it accessible? Yes, in that time it was accessible. Even without video, it was accessible. Even with its disadvantages that you cannot observe what is the client and the participant they're experiencing, yes, it's still visible. It's still accessible. It's still reachable. You can be able to reach to your client and participant. Number two, there's been convenience. We've seen that I can actually give a service as a mental health practitioner. I can give service to someone who is not even in the same country as I. This doesn't stop sessions to go on. Phone sessions are happening, telemedicine is happening, telecounseling is happening, online therapy is happening, avatar systems are in place. It shows the level of convenience that we give to the client or a participant, even to still receive support, even in the time that I am unable to do a face to face counseling or mental health support. Personalization is a critical mental health care supportive system. It recognizes that everyone is unique. Teletherapy considers people of mental health conditions, cultural backgrounds, gender, language, and age. And this allows us to tailor patients' treatment options to meet their need. This is another, a really critical important aspect when it comes to the onset benefits of digitalization, that there is personalization. You can tailor sessions to someone's culture, you can tailor sessions to someone's language. We have one of the tools that is in App Store, the CBT tool that is on online therapy, that can be able to translate in someone's language. I can speak English and it translates for them into their language. These are apps that people are putting up that can support mental health, the mental health supportive role, even in this age of this digitalization. During this time, one of the key things I want us to think about critically may be relevant concerns that would promote digitalization. As mental health practitioners, and even as you look at the ongoing researches that are happening, what do we need to be aware of? What do we need to look out for? What is digitalization doing for us? How is it supporting us as those in the supportive role of mental health? We need to be aware of technology also, how we use it, and the emotions. Life in general has its own stresses. It comes with different life stresses. And this is digitalization supporting us to manage or to reduce or to suffer more emotional challenges. It can do all depending on what view the person looks at, depending on what focus has someone given. But how do we use this technology. Unfortunately, there's all this social media. There is all this social comparison. There's where we compare ourselves with someone we see on social media, how they dress, how they look, which makes us look different. It brings in different disorders. For example, like BDD, body dysmorphic disorder, where I look at someone is dressed so well, their body is well structured. It brings a lot of stress and anxiety for me to have a body shaped that way. It brings, it increases high levels of emotional irregulations that we need to support our clients with. Even in the use of technology, we need to tell our communities to reduce, to have some amount that they reduce on the use of technology. That these are some concerns that are real. And even as we tackle this topic of mental health supportive role in the age of digitalization can be to our advantage, like we've seen. It can be to our advantage, but where are the relative concern? Where do the issues come from? Overuse of digitalization, overuse of technology, that it can bring emotional irregulation. It can bring up the use of different disorders that are uncalled for. So all these things we have to be on the lookout. Difficulty in managing our emotion can be highly linked to smartphone use, internet gaming disorder, unhealthy social media habits, risks of exploitation. We've seen sexual exploitation, sending photos of naked persons, sending pornography, links without actually individuals' consent. There is a lot of internet bullying. There's a lot of internet wizardry. All these are factors that we have to look on. And remember, they change someone's behavior, they change someone's way of coping, they bring in that comparing with each other, which brings sometimes emotional irregularities and disruptions. Another concern that we need to look out for is look at the opportunity loss. As we sit on this technological side, the digitalization, how much mental health advances are we taking on? Remember, mental health comes with different activities. For example, to enhance mental health, as we look at enhancement of mental health, it looks at physical activities. It looks at lowering your depression levels. It looks at how fast is recovery from stress. How can someone cope, assimilate? How can someone be able to adopt the new changing environment and cope with new styles and digitalization, maybe even technology of the age? Some of these things we have to critically look at them. That people, instead of going out for activities that would enhance, that would support low depression levels, that would support faster recovery from stress, depression, and maybe post traumatic stress disorder, technology gets us to be withdrawn. You find someone spending lots of hours on their phone. They can't seem to let go of their phone. They can't seem to do any other activity. There are so many apps that are available right now that we need to look at as threats to our mental health status. TikTok, Instagram, and these are a few to mention. There are so many others that someone can actually literally spend their day. Of course, the own of the technological tool or app or something, they're earning off it. But the person that has their mental state that needs to be stabilized or regulated, how are they affected? We need to look at that valuable time that is spent on withdrawal rather than looking out for our well-being. Oftenly, we look at technology isolating people indoors. Someone spends hours on television. Is that good for your mental health? Does it support your mental well-being? Does it support in lowering the disorders and the pains that come? It's actually increasing social isolation, social withdrawal. Someone is comfortable staying indoors all day. Yet being, instead of being social beings and being able to learn from them and pick from them and be supported with their mental well-being, they are isolated. So sometimes even our clients, we find that they are in, instead of coming for the support that they need, but they stay indoors all day. When we look at well-being, we'll look critically at things that are going to support our well-being. For example, physical activity, taking a jog, taking a walk. With technology, it doesn't really work that way. It will cause you to be isolated, and you find you can't do this physical activity that is going to support you mentally. So, all these are concerns that we need to have a look at. Then, being mindful even for the social media. I had already talked about that. Even social comparison, we look at social media, how someone's maybe graduation happened, that's the same way I want mine. It's increasing stress. Even as we compare ourselves, there are depression levels that come in there. There are pains that come in there because you feel frustrated, not moving forward. You feel like you don't have progress in your life because as you compare yourself with someone, you're the same age. Maybe for them, they have a husband and they have children, and I don't. It's going to cause some level of depression and frustration. Is it really worth it that digitalization is supporting mental health? Yes, there could be all these apps that are available, but how many people will critically follow them and go to them? This is something that the age of digitalization is disrupting the mental health supportive role. For every therapist, these are concerns. These are high level concerns and they are researched. And you find the use of social media, your brain is doing the job of comparing rather than the job of self care and self well-being and importance and increase, and for it to be able to function very well. There's a significant role in self-image and subjective well-being. And with the comparison theory, we looked at this comparison that plays with a significant role in self-image and self-well-being and subjective well-being, that it's sort of disrupted because you're comparing with yourself with people that are you don't even know. You haven't been in their lives. You don't know whether they are lying to you or not, but they've left you with a job to stabilize yourself because of the comparisons, because of the subjective feelings and emotions. Then I think one of the other things that we need to really inherently look at as a risk is, during this age of digitalization, is how we open ourselves up to people stealing our accounts, an ending stream of online scams, false information, cyberbullying. Do we need to stay safe? As someone gives you false information about themselves, when you get to know that you're lied to, it triggers a certain stress level. And this is technology, this is digitalization. Cyberbullying, we've seen the effects of cyberbullying, that they increase someone's levels of emotional irregularities. Evaluating yourself constantly, using of different passwords for each account. It is a lot of work. Imagine you have 10 apps. Imagine you have 10 apps, 10 social media accounts, 10 different things, and all these need passwords. They disrupt, they disrupt, they cannot they don't support someone's mental well-being and emotional and status. So some of these things that we need to closely look at them and look at them vividly. Do they support our mental health? You have to back up your contents, organize your files, you have to update your operating systems. So you find yourself that you have to carefully look at information in retrospect with what others are doing, or keep all this information on your mind. Keep all this information on there, which sometimes just remembering a password can cause pain. Do you know that actually many people forget these passwords because you can't keep all these passwords. You keep evaluating the credibility of sources. You can't communicate respectfully. You don't even just Google yourself all the time. You've seen all these things. This is how safe is the internet. How safe is using technology? How safe is it for all of us to be using these gadgets and tools? Even my data. If, for example, I'm going to use, let's say, an app, how safe is it that all the information I'm going to give, let's imagine maybe say I was raped and I have all these effects that come with rape as a victim of rape. How safe is my data on this app? How safe is my password that I've put in to save in this person, a victim of trafficking? All these are cases that we are looking at, and someone uses an online app because we've told them it's going to support them with anxiety, it's going to support them with stress. But how is it visible that this person is actually going to use this tool and it will support them? But what is the fear behind? How is my data going to be kept? How is my file going to be kept? Who is getting to know this information? Who is behind this app? Who's behind this machine? These are concerns that we need to look at. All of us as mental health specialists, but also as educationists, as researchers, this is what we need to look at. Is digitalization a concern? Is digitalization improving our supportive role for mental health? All this, we need to have a look at them very closely. Yeah, maybe I would want to give some, what, like I gave some onset benefits, but also there are disadvantages, I think, that we need to look at critically. And we need to think about, besides the concerns, besides the advantages, what is it, how does digitalization directly affect this mental health supportive role? One, there's lack of face-to-face interaction. Now imagine online therapy. You go months without face-to-face interaction. Is a human going to improve really with online systems? It's a question for us to think about. Is a human being going to be able to be supported fully, to a fullness, like a full degree, without a person interacting with them? They are interacting with an app. Is it possible? Yeah, maybe as research is carried out, maybe we could see different apps that are supporting people. But digital mental health care or supportive lacks an in-person interaction between therapists and their patients. Unlike the traditional mental health care that occurs in person, you come for the session, but imagine you're on a messaging platform, video conferencing, you won't be able to observe the reaction. You won't be able, how do you take even a mental status exam? Because in status exams, we look at the mood, we look at the affect, we look at how the person physically looks like. Now you're on a video conferencing. Many people put themselves, they improve their looks as they come on video. Do you know that I can be on video and sort of, um for example, get tired? When I get tired of the video, I can say that maybe network is, it has been disrupted or something. But how do you help that person? What happens in the times where you're really the person, there are those therapies where you get to the core. The person feels really they are reacting to the treatment plan that you're doing, that they sometimes break down. How do you support this person as they break down? Is it really realistic that that lack of face-to-face interaction could be a very important aspect? and yet a demerit in digitalization. Yeah. Then we have technological barriers. Yeah, it's something I've just talked about. Internet. As you're still talking to someone, airtime is done. As you're still talking to someone, internet is cut short. Network problems. As someone is now, maybe some people could be now in the US, in the UK, where systems are being built. Now, us in the African setting, most especially where I am in Uganda, there are areas where there is no internet. There are areas actually that even a network call is hard. So, how are we going to support that person who's at the border, someone who's in the deepest village, even with the supportive role of mental health? Or should we just assume that these people don't need our services or activities? We can't just assume. Mental health aspect, depending where you lie on the mental health continuum, everyone needs support. Everyone needs support. We usually, with my colleagues, joke about it and say even counselors need counselors. If I need support, yet I know all the things that maybe I need to do, how about someone who's deep down there? Everyone has a potential of having a mental disruption at any one point, as long as they have a brain. That is something that we need to note. As long as they have a brain. Now, when you get to that place where you need support and you can't call, there is no network, how are we going to deal with that? Technological barriers are key in as a dismerit or as something that that comes with digitalization in this day and era. Let's have a look at privacy and security concerns. This is something that we looked at. How is my data handled? As I put on this particular app, what guarantee do I have that my story won't be up on social media the next day once I put it up in an app? What guarantee do I have that even my data, that my date of birth, my name is not going to be elsewhere? We've seen people be cracking apps and details and everything. This is clear that digitalization needs a check and a research, that this is the greatest concern people have. What kind of consent do you have that have accepted? These are privacy and security concerns, that data breaches, cyber attacks and threats are daily of late. People hack into systems. Teletherapy is susceptible to the threats that occur online. Even as we have conversation, we've seen people hacking into conversations. My sensitive information and details and thoughts being laid bare before the systems. Is it still something that would want to consider even for telecounseling? Yes, there are some advantages to it. Digitalization is supporting greatly. It helps us, like I said, the advantages. It's accessible, it's convenient, it's personalization. But even as organizations and countries take on the tele counseling and the digitalization and the technology, are there things that we need to consider? Are there things that we need to look at deeply, even as we look at issues of mental health and mental disorders? Let us think critically to the person that gives the supportive role. But also let's look at someone that is in the place of the person who needs the support. These are things that we need to look at critically and in detail about the various aspects of the age of digitalization. It's very easy to say technology is good, technology is good. How good is it to you as a mental health specialist? There's a research I was looking at just in the recent, as I finalize, and it was saying that digitalization is still not supporting fully the clinical setting or the mental health aspect of as one who's a counselor or a supportive role of a therapist or a psychologist or psychiatrist, that this still needs person to person, even for you to look out for symptoms and signs. Because as the person is talking, as the person is doing bringing out certain behaviors, That's how we assess. That's how we assess. And mental health assessment, much as there are questions and tools that are administered, observation is key. History taking. You know, someone can actually get tired. For example, people you're trying to take out of isolation, people who have been withdrawn from community because of the different things that are affecting them mentally. All these are things that we need to factor in as we bring in the age of digitalization in our common settings. What are the risks? What are the factors? What are those protective factors? What are the risks that we need to put up with? And we need to give answers even to the client that we work on. Because as we try to engage ourselves in the age of digitalization, is it supporting us or not supporting? Is it supporting our client or not supporting? Yes, if they are going to use a tablet and the video to get their support, that's okay. But how is their information handled? Of course, all these technological tools are with us, but are they supporting us technologically, or are they disrupting our activities that we do as mental health specialists? For any questions, please put in the link before and talk to us in case you need questions. Yes, thank you very much for listening to me. I appreciate, I hope I've really, really worked on this topic and fully done it well. Yeah. Thank you.
We have a question, ma'am, here. You can answer.
Yeah, there is a question that says how mental health professional understand the emotional state of client during online and telephonic medium. What is your advice about telephonic counseling by a psychologist or a counselor? Telephonic counseling or telecounseling or online therapy. Let's start with the first question. How mental health professionals understand the emotional state during online and telephonic medium? How do we really understand this? These are the challenges that we have as even professionals. Now, imagine you're looking at me right now talking to you, but would you understand my mental state by just looking at me in the video? The emotional state is not clear when someone is on a telecounseling. Even someone who would want to cry or break down, it's not easy for them because telecounseling is just giving you, this is how I feel. But is it really how the person is feeling? Because even as you take the observations of the person, they usually will show, as you look at them, like observe them during the session, there are signs, there are things you look at, and you look at someone, they look like they want to break down. Sometimes you want to support them fully so that they can be emotionally stable. But is it does that happen even with the support of digitalization or technology? Is not really supported. During COVID-19, we had that as the biggest challenge. Someone would tell you, I'm physically well, I'm emotionally fine. But as we reassess them after, when we had face-to-face interactions, we noticed these people have become acute cases, yet we had stabilized and supported them fully. How will mental health professionals understand the emotional state of the client during an online and telephonic medium? Is a challenge. That is something I can say. It's a big challenge, most especially non-video telephonic mediums and telephonic counseling sessions. All those, it's a big challenge that needs to be addressed, even by us who give the support, but also by the researchers, maybe even the people that put up these programs of technology and apps. It's a question that we need to answer, all of us. What is your advice for telephone counseling by a psychologist and a counselor? If there is no any other way, it's the best option because it's accessible. Someone will still need to be supported. If it is the only option, for example, when we're in total lockdown, I've given an example, there are areas where you can't easily access. For example, I'm here in, let's say, in Kampala, but I need to support someone in Nairobi. I need to support someone in Kenya. I need to support someone maybe in Nigeria. It's the best option. It's not easy for me to reach out for them. It's the best option. But every opportunity that we get that we can do a face to face interaction or an individual session, a session where we can interact, please go for that because it will give you insight. One, to observe the emotions. Two, to fully take a history take that is good. Three, to be able to read the mood. Four, you can be able to look at the affect of the individual, even reactions. You can be able to observe. Yes, please. Thank you very much. I hope I've answered it very well. What is your guidance to parents? What is your guidance to parents for the mental health of children in the age of digitalization? How much can you support your child even in this age of technology and digitalization? As a parent, how much can you support them to limit digitalization? Technology is taking spikes on emotional disruption for children. Do you know that actually children, adolescents are being abused in our absence as parents? Do you know that? If you can support them to limit the use of technology or and supervise, what are they watching, what are they looking at what particular time, as a parent, can you be able, this is for the sake of your children's emotional state. Because what is happening, like I gave you all the list as social comparison. A child grows up, they don't want to go. I have a recent case right now. Someone has bulimia and nervosa. This is a disorder, a mental health disorder. But it came because a child was a bit healthy and sized up, and they feel a lady to look good, they need to be a certain size. All this is gotten off media. It's gotten off the TV stations. It's got over the systems we think that are proper. This is a force of digitalization. This is a force of looking at things. The different adverts. I want you to tell me one country that doesn't have an advert of how a lady should look like, how a lady should do certain things, even if it's not ladies, even children. An intelligent child should be like this. Children have different capabilities. Children have different unique qualities. So if we enforce some and we don't enforce others, that's going to be a challenge. This is a system challenge. It's going to be a system challenge. So all these things, we need to have a look at them with an open eye and a critical view of the different aspects of digitalization. As mental health specialists, parents should be on the look to supervise. Let them see what are their children up to. What are their children about? What do their children doing with the technological apps and the tablets and how would I call them? Like the system, the things that we use, tablets, phones. What are they doing with them? Because a child can develop a depression or a disorder, mental disorder, just from one app, one technological sentence, image, sound. All these things can bring emotional disruption and irregulation, even psychological distress. Yes, please. Hope I've answered you. Mm. One question: how digitalization leaves a bad impact on the mind, and how one should avoid the bad consequences. Yes, digitalization can leave a bad impact on the mind. The mind, will not go in details on how the mind is, but when you look at the mind, the way it's formed, it takes on visuals, it can take on sounds, it can take on different things. And you don't know what this child who's looking at a media, a television, listening to a sound, how they will be triggered. Remember, even we have sometimes genetical aspects. What is going to trigger them? The bad impact comes with the things that frustrate our being ourselves and having our unique capabilities vis-a-vis the things that should be. For example, like an example I gave you, a child cannot stop not eating because they want to look a certain way. That's a bad impact. It's bringing psychological distress. I cannot be small. I cannot be a model. A child who wants to be like another child who can attend maybe to a spelling bee. Yet for them, they have unique abilities. They can be able to be good artists. They can be able to do good work. But that bad impact on the mind, it gets them in a place of distress and emotional disruption that leaves them with a bad impact, or what we would call a negative impact. Negative impacts all over social media are visible. You can't miss them because even as an adult, we are still affected by these things. We see a friend of ours, they are prosperous, they are doing well, and me, I'm not progressing. I'm going to compare myself. Then you look at a certain course that you want online, but you cannot because I don't have the money. How come you don't have the money? Then you have see someone taking a picture with their mother. Before you know it, it has triggered. Having lost my mother, why is she? I feel bad that I cannot have the same picture with my mother. This impact that is left in the mind of one person is negative. It is negative and it can bring different issues. How do you avoid them? Limit technological consumption. Limit if you can. But even that, already, let's imagine already there's the negative impact. Seek professional help. Counselors are available. Yes, skilled counselors are still few, but seek psychological help. Seek professionals in the mental health aspect. Then number two, we have different, for example, in Uganda we have facilities that have counselors, but also it has people who are sort of like paraprofessionals. I don't know how you other countries call them, like paraprofessionals, people within communities that can support mentally. They may not have a mental health supportive tool, but they have been trained to support. For example, church leaders, for example, community leaders, for example, hospital. Every hospital has a paraprofessional. Then every community has a paraprofessional. Even as the awareness is growing, people get to know where to find this help. Then another thing, try to relax your mind, care for your mind. Trash in will always be disrupting your daily activities, but you can trash it out by by assimilating new information in your system. Can I reduce my intake of certain information? Can I reduce watching certain pornographic, let's say, sites? Can I reduce my watching videos with drugs? Can I reduce watching certain movies? Can I reduce watching this? Yes, you can. You can set bits of targets, bits of targets, bits of targets, and say, this time, let's see, let me take a week and see whether it works out. Tomorrow, let's do 2 weeks. As your mind gets used to these factors, you find yourself lowering the consumption of this information, even the bad impact it has created on your mind. Hope I've answered. Yes, please.
Thank you so much, ma'am. I think the question has over. If any question in the future, you can answer. At
Yes,
last,
please.
thank you so much for a wonderful session and very informative session. I hope we will meet again, and your information, your experience will enlighten a lot of people all over the globe. So, once again, thank you so much for providing your valuable time.
Thank you too. I appreciate. Thank you very much even for listening to me.